good morning, and welcome to Health Talk here on AM 1270 and 96.5 FM. I got my phone going off here in the background. Did you feel it?
No, I didn't. You know, I got a couple of phone calls. I was at home working on the radio show, and I got a call saying, "Did you feel the earthquake?" And I said, "No." Yeah. And my wife and I had been having coffee, and the person that called me said they had a swimming pool, and the waves were moving quite a bit. And when I came in, Peter at the station said it was about a 5 point. I don't know what it really was rated at, or where.
I saw 5.0.
Where was the epicenter?
It's at 7 miles west-northwest of the geysers.
Oh, really?
So, and then, I'm sorry, it was 5 miles west-northwest of the geysers, and then the 3.0 is like 4.5 miles west-northwest of the geysers. So, yeah, I mean, I was in the shower, and my wife comes running in. Did you feel it? Did you feel it? And I'm like, no, I didn't feel nothing. So I guess some of us didn't, and some did.
Well, I guess my daughter was at the Hill Road store, and she emailed me and said, "Did you feel the earthquake?" And I said, "No, I didn't, but I said, somebody must be mad at us. That's the second one this last month, I think we've had.
Yeah.
The last one was in Upper Lake or epicentered around there. I mean, they have them in the geysers all the time.
All the time, yeah.
But anyway, we're here in the studio.
Yep,
we're talking about Health Talk. And
Bill's back from his big trip down south into the land of the Southern gentlemen, I guess.
Well, yeah, it was supposed to be warm down there. And the day we went to St. Simon Island, which is off the coast of Brunswick, Georgia, and we had a board meeting. We normally have it in Madison, Wisconsin, in December. And I just got a call from the secretary of the board yesterday morning. I was going in to tell me about a board conference call we had this morning at 5 o'clock, and I said, "Shelley, how warm is it there?" And she says, 6 degrees above zero. And she says, "Oh, no, wait a minute, it just went up. It's 8. You know, I can take my jacket off." And I said, but there we got there, and it was 70 degrees, and it took us all day to fly from Sacramento to this island, and beautiful, but we got there at 10 o'clock at night. So the next day it was up in the low 70s, and we walked around, and this resort had a hotel called the King and Prince Hotel, which is an older hotel that's been there for years, and it's right on the beach and beautiful. The rest of the board members came in that day, and the next day we had a board meeting all day, and the weather was kind of overcast. It wasn't, but then Friday that was our day off because we were leaving on Saturday, and so I had chosen to go out fishing, me and one of the board members from South Carolina, and we didn't know if we were going in the ocean or if we were going up through the canals, the irrigation system, and the national water system. So we ended up going through the canals. It was about 30 degrees, and we were going 30 miles an hour through these canals. The guide we had knew the area quite well. He'd lived there for several years, and so we were going through the canals at 30 miles an hour, and it was 30 degrees. Gosh knows what the... And I took one of my coats. I had this warm, cold weather gear that when the Derby Hat Club used to go up to Howard's Prairie up east of Ashland, Oregon, and I thought, well, that's going to be way too heavy to take to Georgia to go fishing for a morning. But I wished I'd have had it. I was shaking. The other board member that was sitting next to me was shaking, but he says, I wasn't. He was quite a bit larger than I was, and he says, "I'm not near as cold as you are." And we caught some big fish, redfish they were called, and I just showed Paul a picture of the fish.
Yeah, they were pretty impressive.
So now I've got to go see a chiropractor because of my back, because they were so big. They were around 10 pounds, about 30
Were they
inches
fighters
long.
or?
Yeah, they were.
Cool.
They just kind of laid there until you started to bring them in. They didn't want to come in.
No.
So the guide said, "You want your picture taken?" And I said, "Well, sure." And then I started catching more of them. He wanted to know if I wanted my picture taken every time.
Every
I said
single
no.
one.
And we were also going after sea trout, which we caught a few, but they weren't. They looked just like rainbow, but they weren't large enough to keep. So then we took them to a seafood broil we had at one of the board's meeting homes that night, and it's I'll finish this in a second, but the oysters that you get here on the West Coast come in like a clam type thing,
Sure.
and you heat them and they open up. On the East Coast, they're very long, skinny shells, and they have cavities inside those shells, and the oysters are within each one of these cavities. It looks like a piece of rock from a volcano, like a volcanic rock, and you open them up, and there's really moist, sweet oysters in those, and we probably had 100 of those.
Is it multiple little bits in each one?
Yeah, they aren't very big. They're a couple inches long, maybe, and thin and sweet, and really, really quite enjoyable to eat if you like oysters.
I love oysters.
There were I think there were 25 of us there, and about 15 of us ate the oysters, and we had to shuck them, and they'd throw them in a big fire pit, and then as they'd heat up, they'd start to open up a little bit. A little more harder to get out of the shell. If they'd left them in there but when you have that many to put in there, it's really difficult. But the seafood broil was great. They had shrimp, they had sausages, corn, all of that stuff mixed together, and had a great time. Just the bad part about coming and going to those places is just the flying. It takes all day to get there and all day to get back. But anyway, we're going to be talking about your health. We've got a few days left till that wonderful Christmas holiday where we're going to be opening presents and watching the grandkids say, "That's all I got."
Yeah,
and,
right. Hey, you didn't get this.
Yeah.
I wanted that. And yeah,
but
I know.
Anyway, we're still in the middle of flu season, and everybody I talk to on the phone, I hear this congestion.
Oh, my wife's got it right now.
And so do I.
Yeah.
And there's also about a 72-hour form of viral thing going around that affects the gastrointestinal system. And you get very dehydrated. One of our employees at the other store ended up in the emergency room because she didn't want to drink any water or eat anything, because it was going right through her. So she became really dehydrated and had to get an IV, 2 or 3 IVs in her to keep her from having symptoms as if she was having a heart attack. So if you have that diarrhea for any amount of time, then you need to make sure that this gal was the last person in the world that would ever gone to the emergency room, but she got so afraid of the symptoms that she was getting from being dehydrated, and one of those is lack of potassium too. So, but she bounced right back, and today when you go to a doctor's office, you have to kind of dictate to yourself what happened, and this gal was sitting in the emergency room at a hospital, and went in and told them that she was having a heart attack, and she was waiting just like everybody else, and the cardiologist happened to come in and say, "Why are you sitting here?" And she says, "Well, I think I'm having a heart attack." And he said, "Aren't they doing anything?" And she says, "No, I'm just waiting, So he went up to the desk and said, "Get her in right away," and ran all the tests and everything. And I had another employee that went to a doctor for a sinus infection that she'd had for about 2 or 3 weeks, and she didn't want to miss any work. And usually she's had these for several years, and usually a short course of antibiotics gets rid of it. But the doctor said, "We don't give you antibiotics anymore for sinusitis. You just have to work your way through it." So, and that is the status of healthcare today. People are becoming so dependent on antibiotics for things like that they're no longer effective. And so here you're trying to get it out and trying to make it, and you go as long as you feel like you should go, and you still don't get the antibiotic. And I'm not saying the physician was wrong at all. I'm just saying that's the state of healthcare, and that's the way you're judged today. So anytime you can do something to keep yourself healthy and not getting these things, and one of those, of course, is the flu shot. And a lot of people have lots of reasons why not to get the flu shot. We only have maybe 20 doses left, but obviously people are not getting. Only 2 out of 5 people that are eligible today are getting flu shots. And you ask any kid why they dread the flu shot, they'll give it to you straight. They'll just say it hurts sometimes, and kids aren't the only ones that feel that way. There's about 20% of the adults have a fear of needles that keeps them from getting the flu shot. But it could literally save your life or the life of a loved one who may not be in the best of health. And so kids and elderly people are the ones that are the most apt to have a problem with it and maybe not make it through. And according to the CDC, everyone 6 months of age or older should get a flu vaccine every flu season. So it's never too late, but it's understandable of afraid of the pain. And the more afraid you are of the pain, the more painful it gets, because you have a tendency to tighten up when you're going to get a flu shot. And when that happens, that constricts the blood vessels around the area you're giving the flu shot in, so that muscle becomes tight instead of relaxed. And the tighter that muscle becomes, the more of a reaction you're going to have from the shot. So we try to use an alcohol pad to beginning and kind of massage your arm just a little bit before you get the shot. And you try to, if it's a child, we try to talk to them or.
I'm laughing because I remember the incident with Matthew, and
yeah, Paul brought his
Bill's his best friend until that shot came in.
Yeah, cutest little guy, and he's just grinning and laughing, and I put it in his leg, and boy, he turned on me like a rattlesnake, and we haven't been very good friends since. But trying to, I did one of the physicians or dentist's children a couple of weeks ago, and she was crying when she came in, and then I think I related this on one of the shows, and then she hated me for a minute, and then one of the employees had brought in a puppy, and she saw that puppy, and then she followed her sisters in the next day and was making fun of them because they were being baby about it. But you need to get the shot in your non-dominant arm, meaning if it's your right arm and you think it's going to hurt you a lot, then get the shot in the left arm. And usually with the flu shot, unless you're just really tensed up, you don't have much of a reaction. If you feel like you can skip the flu shot this year because you got it last year, it changes every year. The strain of viruses they use is always different, and they're always hoping that you get they get the right combination of 3 or 4. There's a trivalent and a quadrivalent. And normally we're pretty successful. A couple of years ago, last year we didn't change the strain because we felt like it was exactly the same as a year ago, as 2 years ago, and it was different. So this year it's pretty right on. And then if you think that you don't need the shot because you already had the flu, the distinct possibility and probability is that was a different strain, that you got the flu from the one that you're getting the shot for. So, and if you think it's actually going to give you the flu, we talk about this every year, and it's almost soaking in now. The shot cannot give you the flu. This is a trivalent or a quadrivalent inactive vaccine. The only one that was an active vaccine was the one that the kids were taking. That was a flu mist. It was a weaker vaccine than you get in the shot, but it was an active vaccine. The chances of you getting the flu were a lot less because you were getting a lower dose. And even if you were getting a full dose, the odds of you getting the reaction are still quite small. But everybody that gets a shot today, unless they ask for one that's a specific, more expensive shot, you will get an inactivated vaccine that becomes active after about a week and a half. And so there really isn't any excuse for not getting it. Some of the people say you can wait too long to get the vaccine. You needed to get it in October or November. The flu season starts that way and goes all the way into May. And one of the reasons we say don't start before October or November is because we want you to have coverage all through the flu season. So it works best when it's given earlier in the season, but it still recommends giving the shot as soon as it's available. And the earlier you're vaccinated, the more antibodies and immunity they can develop before the height of the flu season. which is usually January and February. Some people think that it wears out when you get into the peak performance. It really doesn't until probably, most of our flu vaccines are potent until May of the following year, like May of 17 is the expiration date. So getting the flu shot early trains your immune system for kind of the race of the flu season. So since it takes about 2 weeks to build up the immunity, after you receive the vaccine, it's best to schedule it early in the fall, but you're still going to be protected at least into May. So as long as the flu virus is in circulation, it's better to get vaccinated even late in the season than not at all. Some people think if you're pregnant, you can't get the flu vaccine. It's almost mandatory that you get the flu vaccine. And you're never too old or too young to get it. And I have people all the time say, well, I've never had the flu in my life, and I'll never get the vaccine. And I did that 1 year, and I'm telling you, I was so sick. I had no idea that flu could make you that sick, but it can. And there is a respiratory kind of infection that's going through you now, and it will. There's a lingering cough that could last up to 6 weeks. And even if you've had the flu shot, I'm not sure that any antibiotic or any antiviral will work, but there's always a chance that that it's not the virus that you get the flu shot for. But if you don't get the flu vaccine, it's not going to protect the most prevalent virus that's in the area. So any questions, give us a call at 263-5252. No charge usually for flu shots. Partnership Health pays for them. Medicare pays for them. Almost all the insurance companies pay for them. If it's cash, normally it's $25. We're dropping it down to $15 for the end of the season if you have to pay cash. So very important. We just got a flyer from a couple of the drug companies yesterday saying don't forget about if people get Zostavax for shingles, older people, they can still get flu vaccine at the same time. So, and we received another one from the people who provide pneumonia vaccine saying the same thing. Both Zostavax and pneumonia medications have a live vaccine in them. You can't get 2 live vaccines the same day, but you can get a live vaccine and a non-live vaccine, one in each arm, and they don't conflict with each other. If you get 2 live vaccine, it affects the effectiveness of one or both of the immunizations that you get. So just remember, we're going to have one heck of a storm coming up tomorrow, and it's not going to be easy to come in and get a shot. So I think they still say they're going to get like 3 to 8 inches, Paul. Is that right?
It's supposed to have been here last night, but you can see it kind of is trickling in.
Yeah.
So I was under the impression that we'd have heavy rain for longer, but it looks like most of the heavy rain's coming in tomorrow.
Yeah.
And up to 8 inches in some of the mountainous areas. So Cobb would probably get up to 8, those kind of places.
When I got back Saturday, it had been raining heavily in the Sacramento area, and I guess it rained here hard all day. That was on the 10th.
Okay.
So we need it. We need to make sure that we build up those waterways so we can have a good summer. And I noticed back even on the East Coast they were welcoming rain. And it was warm enough to have rain there, not snow, but it will, in the Midwest, they're getting, I have a sister that lives in Iowa, and they're going to get slammed hard today. So all these things from the Northwest is going to work towards the eastern coast originally, and then we're going to be dealing with the blizzards and everything that we don't have to deal with here. I'm glad that we're not going to Madison, Wisconsin next week for a board meeting. So We're going to take a break, and when we come back, we're going to talk about some of the drug companies that are being sued for various reasons and their attitudes. Hi, I'm Bill Kearney from North Lake Medical Pharmacy. Recently, I visited Mrs. Goodwin's third grade class at Lakeport Elementary School to answer some of the students' questions about their health. Here's what they had to ask.
My mom says I should eat vegetables. Yuck.
Vegetables and fruits are what helps keep you from getting sick and builds your immune system up to keep you well. They also help you grow and develop. North Lake Medical Pharmacy, a good neighbor pharmacy, is offering a Healthy Kids Free Vitamin program to the kids of Lake County. Any child aged 2 to 12 can receive a free 30-day supply of children's chewable multivitamins every month for a year. Simply sign up your children at either of our 2 locations at 347 Lakeport Boulevard in front of the Bruno's Shop Smart. Call 263-1328 or at 5136 Hill Road East across from Sutter Lakeside Hospital. Call 263-6192. The Healthy Kids Free Vitamin program at North Lake Medical Pharmacies.
They're good for us.
This is a test to find out if you know it all when it comes to children. Time starts now. Name one of the leading killers of U.S. children age 1 to 13. What's the best way to protect children in a car crash? At what age and size should a child start using a booster seat? Where can you find the answers to these questions?
Car crashes are one of the leading killers of U.S. children. Many of those deaths could be prevented by making sure that kids are in the right seat for their age and size. Don't assume you know it all when it comes to car seats for your child. Go to safercar.gov/the-right-seat and know for sure. That's safercar.gov/the-right-seat. Brought to you by the National Highway Traffic Safety Administration and the Ad Council.
Paralyzed Veterans of America, National Service Officers.
We've got an entire generation of men and women who have seen war. They're going to need voices.
Paralyzed Veterans of America represents them.
We're going to make sure that the Veterans Affairs gives them everything that they're entitled to.
Get all the health care they need.
Making a person's house adaptable.
And we also focus on getting them a job.
We help our veterans for free.
Changing lives, building futures. That's Paralyzed Veterans of America. To learn more, visit pva.org. A public service message from Paralyzed Veterans of America.
You've spent a lifetime making excuses to hide the fact that you struggle with your reading.
I'd read it, but I forgot my glasses.
Well, I don't need a menu. I'll just have whatever she's having.
I'll look it over later. I have a headache.
I just like getting my news from TV instead of the paper.
Oh, my eyes are too tired to make out print that small.
Just give me a landmark to look for. Who looks at street signs?
Oh, I don't need recipes for cooking.
I don't have time to fill this out right now. Can I take it home?
If you're tired of making excuses, there is help. Your public library offers a free one-on-one tutoring program specifically targeted to your reading level. You'll meet weekly with a tutor at a place and time that's convenient for both of you. To get help with your reading or to volunteer as a tutor, contact your local library. Call 888-767-7323. That's 888-SOS-READ. Or visit libraryliteracy.org. Don't hide any longer.
All right, we're back.
We are back. And one of the things that I have done in the last few weeks is gone over people's prescriptions, whether they get their prescriptions from me or somewhere else, and tell them if there's any interactions or reactions with medications. And as I dispense medications less and less, I'm concerned about some of the medications that are being put onto people that maybe it's not the wisest choice to make. And some of those are ones that have major psychotic reasons for putting them on, and Pfizer, which is one of the biggest drug companies and used to be one of the most ethical drug companies, has just paid something like $19.6 million for detailing physicians and having them prescribe medications that were never intended to be prescribed for that. And one of those is Abilify, which is an antipsychotic drug. And it was being prescribed for people who were becoming demented and convinced the physicians that that would help get their memory back. Well, it was never intended to be used for that, and there is an extreme amount of side effects from using that medication, and what it did in many cases was make people worse. And so they fined them for detailing physicians and prescribing that for the other thing that they used it for were kids that had ADHD. And I've had people close to me that were on that drug, and I would just cringe, because when you get on a antipsychotic medication, it is something that really affects the way that you think, and they're generally used for people who are bipolar or people that are schizophrenic, because they hear people talking to them, and they, in many cases, not all cases, and it has been effective, but there are side effects to having those, and it was never used to be prescribed for kids. So that was another thing that they were fined for. Now we have another drug that is an antipsychotic drug, and they're suing the company for men or adolescents taking it for kinds of behavior problems. And one of the major side effects was it's risperidol, which has been on the market for years and years, and it was a drug like Haldol, which would make the brain think different than it was. People that were just out of control, and so they took young males, and this example was a 13-year-old was suffering from a side effect that wasn't disclosed at the time, and he was taking it for bipolar and an anxiety disorder. And what happened was he grew breasts, a condition called gynecomastia. It causes teen boys or men's breast tissue to grow, and thousands of others are preparing to sue Johnson & Johnson, which again was a big ethical company, for claiming the company did not disclose the possible side effect in a timely manner. It's not uncommon sometimes for teenage boys to develop breast tissue during puberty, but this is different. The breasts were a result of weight gain, also something many who take risperidol go through initially, and then it goes away. If this individual knew the side effects of the medication, he never would have taken it. Soon after the breasts become noticeable, he stopped going outside with friends. He started getting bullies. He'd go to the locker room and people would point and stare. He was already on this for bipolar disorder and anxiety disorder, and then you throw this on top of it. Everybody's picking on him because he's a boy with boobs. In 2006, after the drug spent more than a decade on the market, available to teens, the company placed that as a side effect on the labels, but it was too late for many of those people. In a statement to CNN, Johnson & Johnson said on behalf of Janssen, which is the company that manufactures it, it considers it a useful drug, essential to helping those people who have that kind of disorder and a mental illness, but physicians decide how to best treat their patients, and that certainly isn't the right way to do it when people like that suffer. But since 1994, when they put risperidol in the market, there was a significant amount of attention and controversy. The company had to pay more than $2 million in penalties and settlements to state government entities as a result of lawsuits and 2 other drugs. And in one of the largest healthcare fraud settlements in history, risperidol and 2 other Johnson & Johnson drugs were promoted for dementia when risperidol was approved only to treat schizophrenia, and that other drug was Abilify. The conduct at issue in this case is the patient suffers, and maybe it works for what you were trying to prescribe it for, but it doesn't work. It isn't fair with the side effect that I just talked to a patient the other day, and they were taking one type of medication, and they were also taking another medication for migraine headaches, and there was a contraindication between using the two together because they could cause a serious condition. And the patient wanted me to tell them whether or not they should take it or not. Well, I looked, I've known that a condition like that exists, but I didn't know the percentage of people developing the side effect as such. And so I researched it and found out that one research company said they thought it was an insignificant side effect, and the other company thought it was very significant because they could develop a thing like Stevens-Johnson syndrome, where there was an increase, a double increase in the amount of serotonin in the brain, and that could eventually lead to a heart condition. So when sitting down with the patient, I said, you know, I always talk to patients about risk versus benefit. And when I look at the risk of the possibility that something could happen, even though the percentage might be low, I would have to really advise against you taking both of these medications. Now, I'm not trying to be the doctor, but the patient was also trying to stay away from anti-inflammatories and that helped the migraine headache. And what I suggested was to take acetaminophen or Tylenol for the pain in another location, and also see if that would help the migraine headaches. Migraine headaches are really 3 or 4 stages, and if you get a treatment for those in the initial stage or even the secondary stage, when it goes to the tertiary stage, you're not able to stop it, and then you end up being bedridden for a while if you have an extreme case of migraine intervention. So the department also alleged that this company promoted the drug use in children and people with mental disabilities despite knowing the health risks, and said it was one of the company's base goals. And I was looking for research yesterday to do something else, and I went online and I wrote an editorial in the paper about CVS Caremark and what their goals are in growth. And this was a few years ago. And the CEO at the time, who was making $30 million a year, excuse me, said their goal was to put independent stores out of business. Just close them up, and that's what they wanted to do with me, and get rid of them, and they just take over the business. That was the easiest way to attain growth. And they had no qualms about doing that, no qualms about putting all those people out of work, no moral obligations to the community, no reason to apologize for, once they became a Caremark store, from prohibiting their patients from going to another pharmacy. If they signed up for CVS Caremark, the formulary was only good at a CVS Caremark store, and you wouldn't be allowed to use the formulary that their patients would be able to use, and essentially we would go out of business. Well, I don't know how long ago it was when that company came to town, but the regional manager came into my office and said, and I offered to help them out. And my goal isn't to badmouth specifically CVS Caremark, but they're one of the big violators of trying to promote local business. And I asked him if I could help him around the hospital. I was on the board of directors at the time, and he says, I don't need your help. My goal when I came here was to put you out of business. Essentially, that's what these medication companies are doing. Rather than go out of business, they're doing, they're making inferences that these drugs can be used for things that they've never been tested for, and the the federal government is fining them millions and billions of dollars, but that's a drop in the bucket compared to the amount of money that they get for selling these drugs on the market. And many times they don't admit that they've done anything wrong. They just pay the fine without an admittance of doing something wrong, and then they just continue to do it. And as I got into this further, I noticed that there was 1 in 6 adults that takes psychiatric drugs. And when I saw the headline, I said, and this was on CNN, and I said, there can't be 1 out of 6 people that take psychiatric drugs. And when I talk about psychiatric drugs, I talk about things like Haldol and Risperidol and Abilify and those kind of things that alter major brain functions. And when I looked at the article, their concern was about people who took antidepressants. They called that a psychoactive drug, which I guess if you want to, you can call it that. It's an antidepressant that increases the amount of serotonin in the brain, which is a drug that and norepinephrine make you feel good. It's a feel-good chemical. And it doesn't really affect the way your brain functions. It just puts a chemical in there that you has been part of your system and has been depleted, and allows you not to think differently, but maybe to act differently from a space of well-being. Well, we started looking at the people, and they found that between the age of 60 and 85 are the highest amount use of psychiatric medications, and more than a quarter of the people between 60 and 85 use those drugs, compared with just 9% between 18 and 39. So nearly 18% of adults between the ages of 40 and 59. Is that a bad thing? You know, I noticed an ad on television the other night, Paul, that said, if you're 85 or younger, you should look about getting an insurance policy or taking this medication. I have never seen an ad that addressed people that are 85 or younger. I mean, you know, most people died in their mid-70s or mid-60s, and
right.
now they're trying to sell insurance to people that are 85 years old.
Wow.
And that's it's a symbol of the times.
Yeah.
I don't know. Your father died early. My father died early. My mother lived to 94, and we didn't know what to do because we'd never been around anybody that had lived that long.
Yeah.
So now people are living to be over 100. I think the oldest person is 117.
Wow.
And that doesn't mean they have a quality of life, but we still are treating them medically, to let them have a quality of life until a friend of mine is going to turn 100 years old on April Fool's Day. Still witty and, can't hear very well, but, I don't even know if I'll be able to walk, by that age, if I keep falling every place I go. But we have to look at the world today as if we're going to be around longer than we have, and if it takes medication to do that. And I don't, specifically the top 10 psychiatric drugs in this new study were antidepressants, Zoloft, Celexa, Xanax, which is an anti-anxiety pill, Ambien, Prozac. Most of those, Trazodone, which is an antidepressant, most all of these aren't in the psychiatric category to me. So drug use is unevenly distributed across the population. 20.8% of the white adults reported the use of these drugs, compared with 8.7 Hispanics, 9.7 of black adults, and 4.8 of Asian adults. Women were more likely than men to report using these kind of medications. 1 out of 5 women reported taking a drug during the 1-year period. But I just don't buy the fact that antidepressants are psychiatric drugs. When you start aging and you're able to do less and rheumatoid arthritis and muscular dystrophy and Alzheimer's disease and dementia and Parkinson's disease, and all those things start limiting the mobility and the ability to ambulate and get around and function. People get depressed. And even if your mind is fresh at the time, I can remember when my mother went into an assisted living place, and she was 85 years old. And I said, she was back in Iowa, and I said, "How are you doing, Mom?" And she says, "I'm really depressed." And I says, "Why?" And she says, "Because every time I meet a new person in the dining hall," she says, "we become good friends, and they die."
Yeah.
And as we even age at my age, and we see the amount of people that we've lost in the past 6 months that are no longer around anymore, and if you're in an environment where you're with people all that age, it has to be kind of devastating to not have friends anymore. I had a lady from Kelseyville a couple of years ago, and she was 93 years old, and she'd come in. She was still driving, very sharp, and she said, "Bill, I don't know why God lets us live this long." And I said, "Why?" And she says, "I've lost all my friends." She says, "My grandkids and kids all live someplace else." Mm-hmm. And she says, "And I just come in and get drugs to survive for another month. And I don't know what the reason is for God allowing me to live this long, because I'm not enjoying life at that age." And I could really understand what she was saying. And she had all her faculties. I mean, she was, but she was lonely. And she was still able to cook and drive and do all those kind of things, but she was running out of friends, and family lived in a different location. So, I could see if something happened to me, my wife would move to be around the grandchildren, because the people that move away from here, even temporarily, and go to a warmer location in the wintertime, aren't here half of the year, and so that makes it. And it being in a rural area, it's. I was watching this show last night on people buying homes in the Yukon, and this gal was a single mother. She was a mechanic, an airplane mechanic, and had traveled all over the world repairing airplanes. And I didn't know if her the father of the child to be they were divorced, or if he died, or what. She wanted to live in the Yukon, off the grid, with not being around a bunch of people, by herself with her baby. And one of the homes that they looked at, she'd have to cut 12 cords of wood a year, because the heat was actually, they had a heating system that was off the grid that was a triple backup thing that actually made glycol and then sent it through the pipes and kept them warm. And I couldn't imagine. I couldn't have cut the wood. They said it would have cost her $3,000 just to cut the wood to live. But the isolation of being in a place like that, and they were 2 hours from, I don't know if it's White something, and just to go to a grocery store. So, the pressure that would put on somebody, and I grew up not being able to go next door and play with kids, because we lived on a farm, and it was 400 acres, and it was another mile to somebody's house. So you learn to grow up and play with your sisters or brothers or whatever you had, and no communication outside except at the school. So when I see people that I see an article where people are taking more and more of these medications, and they're calling them psychiatric medications, I'm just not used to seeing that. And another factor influencing those rates of use may be the prescribers themselves, since psychiatrists are underrepresented in rural areas like this. The primary care doctors and OBGYNs and other doctors are increasingly prescribing drugs for mental illness because they don't have a psychiatrist available. As a result, drugs may be prescribed more for others due to a doctor's comfort level. So general practitioners in areas like this are usually more leery of antipsychotics, and yet you have patients that are trained. I can't tell you the number of interactions that I've had with people in the last 6 months of people that are not getting good medical care right now because they don't know where to go. And in Lake County, of course, we've had all these crises with the fires, and we've had situations where physicians are growing old and getting out of the practices, or they just have been doing it long enough and the compensation isn't there and they're leaving, or going to work for an 8-hour-a-day, 5-day-a-week type situation. And I'll be interested in seeing, as we've talked, Paul, many times, what's going to happen with Obamacare or Covered California. It looks like it's going to be more difficult than one had imagined to change, but there will be some changes coming for all of us. And at this point, we still don't know what's in Obamacare, and that's part of the problem with us continuing to see things develop in the Health Act that's causing us to. One of the things is going to be compounding, which the state of California is going to force us to give up the art of compounding by the end of January. The reason is it's going to cost us $150,000 to provide a laboratory that we can provide prescriptions for 60 patients a month, and that's not enough for me in my lifetime to generate enough revenue to pay for that. So the rest of the country doesn't have to do this until July of 2018. California has decided that it has to be done by January of 2017, and there's no forgiveness. They're dead set on the implications of doing that. What it costs me is going to be much less than what it's going to cost a hospital to do the same thing. You're going to find, and we would have to raise our prices significantly. I have spent the last 5 years developing a compounding business, and with my tech Cindy, and who I've sent to Houston, Texas, to learn the compounding. We communicate with them on a daily basis. Yesterday we were on the phone with the pharmacy consultants there on 4 different occasions for a cream that one of the local practitioners wanted us to make for a specific procedure they were using in physical therapy. So it's going to be a loss to the community. It's going to be a loss to me. Somehow we have to make that volume up in order to survive. But that's just how much things are changing, and there doesn't appear to be anything on the horizon that says we'll work with you so you can afford the expense in order to make this great. I'm 74 years old. I'm still practicing pharmacy. I'm still running 2 pharmacies, and I passed up the opportunity to sell my pharmacy at a substantial rate just because I wanted to survive in this community, and I wanted my employees to have a place to go. Was that the right thing, to rule with my heart instead of my head? Probably not for me at my age, but I still did it, and we want to survive. But when you look at the attitude of what the drug companies have and the attitude of the government, things are going to have to change rapidly for us to be able to survive in this kind of environment. That's why I'm gone a lot. That's why I'm in meetings all over the United States. We're trying to get things so you as our customer and you as our patient can survive without it costing you so much money that you can't afford to support us. If independent pharmacy is going to be here, then we have to make it cost affordable to you. And it's not only the pharmacy that's costing you money, it's the insurance companies. And so you no longer can change your Medicare D plan anymore. That was over on the 7th of December. So now you're stuck with whatever you're going to have for another year. And if you didn't look at that and change it, shame on you, because I can almost promise you that it went up, and it went up substantially. And not only did the premium go up, but the copay went up, and also your formulary was being reduced. And it's pretty impossible to understand what to do with that formulary if you don't know the drugs that you're going to be on in the next year. So all we can do is have a positive outlook and make sure that, I've thought about what we said last week on the show, that, don't tell somebody that has been diagnosed with cancer that having a positive attitude will help. I really disagree with that. In any kind of a disease state, I think your mental capacity to handle whatever disease that you're going to be harbored with is going to have an effect on the outcome of that disease state. So keep a positive outlook. Next week when we are on the show, we're going to be talking about how to eat healthy this year coming up. We just told you a couple of weeks ago, eat whatever you wanted at Thanksgiving, and and Paul and I are going to be on next
Oh yeah,
week,
we'll be here.
And we're going to talk about what you can do to stay healthy. And I was just talking to a person last night, and she was listening to a show, and she said, and by the way, if you haven't gone on KXBX AM and looked at and clicked on Health Talk, there's a picture of me in a red shirt with headphones on. We have pods down below that you click on that give you the dates of the shows, and you can listen to a show if you miss it, or if you just want to go back and listen to it. Just click on it. KXBX has made that available. It's no cost to you to listen to those shows. Be more than happy to get your feedback on if you think it's a valuable tool or not. We'd like to remind you we're Northlake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192, and outside the Bruno Shop Smart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Come in and see our Christmas gifts. We have some beautiful ones. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday for Health Talk on AM 1270 and 96.5 FM, KXBX Lakeport.